Welcome in, everybody. Welcome in. Good morning. Good morning. Good to have you all here. All right, all right. Let's go ahead and get started. I didn't want to touch this case because I'm late to the game on this case, but seems like it's one that is gathering the nation's attention and something that it's a very sad situation all the way around. So I figured, why not? These are all just opinions. I'm not a doctor. No one, I don't know if anybody else is a doctor, but I'm not a doctor. I'm not a psychologist. I'm not a clinician. I'm just someone who's giving my opinions and thoughts. And with that, that's where we're at. So let me start off by Carol. Good morning, everyone. Pam, good morning, Dee and everyone. Pam, hey, Carol. Miss Barney, hey, Carol. Miss Barney, hey, Pam. Carol, hello, Pam. Carol, hello, Barney. Barney, good morning, everyone. Pamela, Pam says, hi, Barney. Miss Barney, I don't remember much about this Clancy case. Yeah, I'm with you, Caroline. I'm with you, Miss Barney. I'm with you. I don't know a lot about it. I read a lot, but I don't know a lot about it. So we're both going to be I'm going to be navigating through very, very slim views. Carolina, good morning, DD and Chad, Miss Barney, Lindsay. Is Lindsay in a wheelchair? Yes, she is in a wheelchair. Carol, hello, Carolina. Carol, I think so. Barney, hi, Carolina. Miss Barney, there is too much hate and anger in the world. So sad. Ole, good morning, everybody. Pam, hey, Pam, Barney, I agree. Marianne, I need a nap already. Hey, Ole, Carolina, I haven't really followed the case, so I'm behind in class. You and me both, and Barney as well. Carol, be right back. Miss Barney, I'm behind too. Good morning, DD in chat, says L. Miss Barney, is Lindsay the one that carried on and speaking to her son or children on how sorry she was? She understand that they want nothing to do. I'm not sure if that's the one or not. I haven't read anything to say just that, but that doesn't mean that it's not in there somewhere. Carolina girl, good morning, 1985. How are you feeling? Miss Barney L, good to see you. April, good morning. Barney, good morning, April. Good morning, DD. Norma. Pam. April, this is still going on for this case. Trial is, yes, it's still going on. It is still going on. They're now, the defense basically is now doing their turn after the prosecution just got done a couple of days ago or so. But once again, understand everybody, I am coming in blind. So I know Doug has a lot of information, has been following this case to the T. So I will be referring to him more than not. All right. There is the link. There's the link, Doug. L, I don't know much about the case. Will be new to me. Will be new to me too, because I don't know a lot about the case. Doug, good morning, Doug. Pam, hey, Doug. Good morning, DD, April, Barney, Carolina, Oleg, and Devil Pops. Hello, Pam, April. Hey, Doug. Good to see you. Welcome in, Doug. Welcome in.
Hey, I made it.
All right. Give me 1 second, everybody.
Diving into Lindsay Clancy. Not the case. It's a tough case, but it should be followed, I think. Let's see. How am I going to do this thing? So I can see what y'all are saying. Check if there are any questions if I can.
All right. All right, everybody. So, Doug, I'm going to refer to you, if you don't mind, to a lot of things since you've been following this case closely.
Absolutely.
And I will refer to you more because, like I said, I just read about this case. I really wasn't going to touch on it. And I just decided, you know what? Why not go ahead? I mean, it seems like that's the interest right now of the American people.
Yeah.
So,
for sure.
Now, one thing I want to say before we get started, I want to go ahead and make a clarification. I'm hearing a lot of back noise. Is there a lot? There you go. You're good now.
I had the other phone was on. That was my bad.
Oh, okay, you're good. So I was looking into. I'm going to cover this real quick. It's just take about 5 minutes. So on the Nolan Wells case, I did some looking back, and I had stated that I had still hear that back noise. Really, there you go. So I heard a lot of, I was trying to look for information that I had put out there that stated that.
I had my YouTube open still. I'm sorry.
Okay.
That should be.
All right, there you go. Still a little bit there, but all right.
Really?
Yeah.
Maybe, let me back out and come back in.
Okay. So I want to go ahead and let everybody know that I went ahead and looked into it, and I had stated that in the Nolan Wells case that Katie McCormack had stated that she saw Nolan in the boat. I cannot find that. I know I heard it somewhere because I would have never just come out and said that. The idea is that I can't find it. So I am going to retract that comment in reference to Katie going ahead and stating that she saw Nolan on the boat, because I can't find it. But I did look for it. I know I heard it somewhere, and it could have been a podcast, could have been somebody else's stream. I don't know. But nevertheless, I just want to go ahead and clarify that I'm withdrawing that opinion that she was on the boat, because that she said he was on the boat, that she saw him on the boat, because she didn't say that. Or I might have heard it, but I can't find it to validate it. So I want to clear that up. On another note, Katie never said that she saw Nolan walking towards the boat and thought that he was going to get on, that they would have never left him behind. She never stated that either. Okay, that came from her sister. That came from her sister and her mother, who stated that's what they said on Facebook. Katie never said that. Katie never once stated that. That's never come out of her mouth, that she went ahead and basically that she said that she saw him walk towards the boat. That Katie hasn't made a comment other than to the police, a statement she told the police, and the family. The mother and the daughter are the ones that said that she spoke to the Nolan Wells family and gave them the same information she gave the police. So nothing really has come out of Katie's mouth in reference to that. They did have a message, but that message is not something that can validate to say, yeah, she said that, she was, for a better lack of words, that she went ahead and agreed that he wasn't on the boat. You got to remember, that was coming from the sister and the mother. But as far as me saying Katie went ahead and said that she saw him on the boat, I could not find that. I was wrong. I could not find that anywhere. So I just want to retract that. Okay. just so we're, because if I find something that I said that I cannot validate, I will tell you. So I do want to clarify that. Now we're going to get into the case with Clancy. Bible, welcome in, Bible. Tabitha, good to have you, Tabitha. Good to see you. Heath, good. Heather, good to see you, Heather. So I don't know a lot about this case. I'm just going to give you that little bit on the front end, and then I got to see what everybody knows, because Doug is probably going to do more of the talking because he knows more about this case. So let me just leave it at that. So Lindsay Clancy, she's from Duxbury, Massachusetts. Thank you, Pam, for supporting the channel. Patrick Clancy is her husband. They had 3 children: Cora, who was 5, Dawson, who was 3, and Kaylin, who was 8 months. They were married for 7 years. People describe Lindsay as a loving, attentive mother. She was loving and attentive mother. The issue is that at some point she unalived her 3 kids, and then tried to apparently take her own life by, for a better lack of words, I don't know how to word this one, by nicing her wrist, and then I guess going out of the 2nd story window of the house. So that's the little bit that I got. Now, the defense, they're claiming that she had psychiatric illnesses, that she was going through postpartum psychosis, compounded by undiagnosed bipolar disorder and medication problems. The prosecution is claiming that they don't deny that Lindsay was struggling psychologically, but their argument is much narrower. They said she was mentally ill, but she was not legally insane when she unalived her children. Now, there's a lot of nuances in this, a lot of little things, and that's when, obviously, if you follow the case, you would know. I don't know these little nuances, okay? So, I mean, I could read them to you, but it's, since Doug's here and Doug knows more about, he's followed this case, I'm going to let him take the lead. I know there's a lot of squeaking going on. I'm not sure why, but there is. So that's where that's at. That is where we are at. Okay. So now,
Is it me? It's got to be me.
yeah, I'm not. Yeah, now it's quiet. No. Every time that little thing like pulsates with your initial, it does that. With your not initial, but your D, picture. There you go. It's quiet now.
I'm just going to have to turn my chat off, I guess. That's all right.
No, you're good there. It comes and goes. It's not like it's anything.
Yeah, I'll try to stay as neutral and unbiased as I can, because I have my own opinion, but
yeah, no worries. And understand
nuances as best I can without.
No problem. No problem, bud. I know you're going to have more information. So therefore, in everything here, really, there's obviously some facts that you can claim as facts because the doctors, the psychiatrists, all these people who issued medications and all that. I mean, for the most part, there's probably going to be pretty valid. As far as any thoughts of who, what, when, where, as far as like why, yeah, I'm not a doctor, I'm not a psychologist, but I will say that all my thoughts are opinions and opinions only, because I don't know. And even if I knew this case, it'd still be just an opinion for me, because I'm not a doctor or someone who can really answer those questions. You know what I'm saying? So these are all just opinions, everybody, and thoughts and what you think. Thank you, El. Appreciate you supporting the channel. Good morning, Melly. So with that, I'm going to hand it over to Chris, and I'm going to let him, or I'm sorry, hand it over to Doug and let him go ahead and tell us about this case as he knows it, and we'll go from there. You got the floor, Doug.
All right, so I don't really know where to start. I mean, you went over the basics of everything that's been going on. I know April's been following the trial also, so she probably can chime in on a lot of different things. But yeah, you touched base on a lot of the facts, but the nuances is just Lindsay was seeing a lot of, she was going to multiple different doctors. So she was getting different drugs from different doctors, and the doctors weren't even talking to each other or following up on different plans. And yes, Lindsay was not following the plans completely. But that's, I think, mainly because a lot of the drugs weren't helping. They were making things worse on her. And the defense is saying that it was postpartum psychosis, which she got to that point because of the undiagnosed bipolar disorder. So if you talk to some of the doctors, they say that she exhibited a lot of the things that would cause bipolar, but with the exception of the mania. But then we heard from other doctors that said that there actually was mania, and she actually did have bipolar, and any person with bipolar shouldn't have been prescribed some of the medications that she was getting, and it was actually intensifying her symptoms instead of making it better. Gotcha. Which mostly was the benzodiazepine, and she was taking them for sleep because the Zoloft that she was getting was making it so that she couldn't sleep. So she was on this wheel of not feeling all right and then feeling all right, and then she would take the meds, she'd sleep, but then she became dependent on them, and then she wasn't sleeping anymore. So she was going up and down, like exhibiting mania symptoms, but they were blaming it on the pills more than an actual diagnosis. So after months of not sleeping is what they're claiming led to the psychosis, because we know after 24 hours, 48 hours, 72 hours of not sleeping, you can start hallucinating, having out-of-body experiences, and eventually just not be yourself. And that's where it ended in the end. So it was a combination of a lot of different things that were happening, and she was telling the doctors how she was feeling, and nobody was listening. She called the suicide hotline twice. They didn't intervene. She checked herself into the hospital. There really was no intervention there. She was telling Patrick she had thoughts about hurting herself and the kids. She told her parents she had thoughts about hurting herself and the kids, and there was never any actual intervention. So that's where it's at right now.
Okay. So
that's a pretty good explanation, I think.
Yeah, absolutely. So that's pretty much the synopsis of what we got now. The any questions on that for now? April, if you want to come on up, you're more than welcome to come on up, since you follow this case as well. You're more than welcome to come on up. Just letting you know. And just in case, if you want to come up, there's the link right there. All right. So the defense says about Lindsay that she's suffering from, like I said, postpartum psychosis, bipolar disorder, severe depression, hallucinations, medication-related problems. The prosecution is contending and argues that Lindsay's symptoms don't establish legal insanity. Some medical professionals who treated Lindsay before the unaliving diagnosed depression and anxiety, but did not believe she was psychotic. So the jury has to decide whether the defense expert's retrospective assessment is more convincing than obviously their contemporaneous observations of her treating provides. So basically, That's what both sides are looking at. That's what they're going. She's never denied that she unalived her kids. She never denied them. Although one could say, did she even remember that? Right? I mean, did she even remember doing that? Did she even remember, jumping out that second story window? You know, I don't know, and I don't know if you know, Doug, but I mean,
She claims that she doesn't remember.
okay, so she doesn't remember. So, and that could be a part of for a lot of reasons, good or bad, in her favor or not in her favor. There could be a lot of reasons why. Tabitha says, sounds like she was really reaching out for help. By the looks of it on the documentation, it does seem like she was trying to get better. I did read that her mother-in-law said that she was a very caring individual, very attentive to her kids. She was a very loving person. That was coming from the mother-in-law. And then, of course, the mother, that they didn't notice anything. They noticed a lot of things happening, but they only noticed it once she got on her medication. That's at least what I read. Is that correct? Or do I need to clarify that, Doug?
Yeah, no, that's pretty much. I mean, she experienced some of these symptoms in her previous pregnancies too, but it was the one with Callan where it was really, really bad for her.
Okay.
And intensified.
So the defense interpretation, the defense says the same behavior has to be understood before the lens of severely psychotic women who was no longer thinking normally. The fact that someone performs organized actions doesn't necessarily prove that they aren't psychotic. So the question becomes major issues among psychotic experts. The unaliving, she unalived her 3 children at her family home. Now, I read there that the children were, obviously, I told you the ages 5, 3, and 8 months. She used an exercise band to go ahead and basically wrap around there, and to unalive them. That it's kind of like an elastic band, that they use for countermeasure on pressure, weight,
Yep.
She used this band.
That's 3 different bands. There was one for each child.
Yes, each one had a different band. This is important because this is primarily a she didn't do it defense. It's she did it, but was she legally responsible for doing it? In other words, was she in the right state of mind is the question, or is what they're actually asking.
That's right.
After the unaliving of Lindsay attempted to unalive herself, she took medication, injured herself, and jumped headfirst from a second-story window of the house. She survived but suffered devastating spinal injuries. This is why she's in a wheelchair. Let me pause right there for a minute and answer a couple questions here.
Yep.
There's a significant difference between type 1 and 2. If doctors are disagreeing about that, that's interesting. Carol, why would she be allowed to be alone with the kids? I don't know. I can't answer that. I really don't know. Do you have any idea why, Doug?
Nobody's seen the signs.
No one's seen
that was the big problem. Nobody see, even like when she reached out to the suicide hotlines, because she didn't have a plan on how she was going to execute it, it didn't reach the level of intervention.
There you go. And that's usually what they look for. And that's what most people will ask when you go in to get not only a therapy, but when you go into a hotline or you even go to the doctors, the first thing they're going to ask you is, do you have a plan? Because that's usually the main thing, that if somebody has a plan, okay, that's usually the driving force behind going ahead and getting them, for a better lack of words, getting them admitted. Okay. for a better lack of words, because that's when they know that person is ready to, complete whatever their plan was. Um, L sounds like she tried to get help. Unfortunately, even when people seek help, they are quickly discharged due to insurance issues. It's very true. That's very, very true, L. Very true. Song, welcome in, Song. Do I hear squeaking? It's just Doug's
Sorry.
little noises. You're good. It's just Doug's little thing, but it's okay. Uh, there you go. Now it's quiet. As
And
soon as
then
I
to
say that, it goes.
the insurance thing. Remember, where Lindsay she was actually worked in the birthing unit in the
Yes,
maternity ward. She was a nurse. She
yes.
had great insurance. I think it was Cross Blue Shield. So I don't think the insurance in any way had anything to do with the decision making. It was the doctors not seeing the signs and the possible misdiagnoses.
So that is very true. She was a nurse. She was at the birthing unit, and Doug is right. She did have good insurance. We know then on a factor of a lot of people, that's what they get hindered with. Is insurance only will do so much or want to do so much, but in this case, she had that covered, and she did by all means try. In my opinion, from what I read, she did try to reach out for help. Okay, she did try to reach out for help. She did reach out. She did make contact. She saw multiple of different psychiatrists, as Doug has pointed out. She saw a lot of psychiatrists. She's and Doug makes a good point. In everything I read, it didn't seem like the psychiatrist and her doctors or whatnot were all talking to themselves. They weren't talking to each other. They weren't trying to. In my opinion, it didn't appear by what I read that they were getting each other's information and corresponding with one or another. It seemed like they were just, going with how they diagnosed what she had or what she was going through. Is that fair to say, Doug?
No, that's exactly, and they even corroborated that in their testimony. Not one
Okay,
of the doctor knew what the other doctors were doing or prescribing. They were only privy to what Lindsay was telling them.
got you.
So a lot of people are saying she wasn't being totally truthful, but some people were saying she is. So it's just there's that too. Like, at what point does a sick person advocating for herself become the problem? And I think that's at the core of the arguments.
Got you. Makes perfect sense. So her husband didn't see it. No, her husband didn't see it. So apparently, the way it happened, and I don't have exactly how, but she had called the husband. She was out playing with the kids. She called the husband, asked him if he would pick up dinner. She wasn't in the mood of making anything. So she went ahead, asked him if he would do that and if he would pick up some. What was that medicine she wanted him to pick up?
So stool
Oh,
softening.
yeah, stool softener, and for the kids. And so he had to go to both of those places to get that. Um, and in that time, there was I want to say like a 50-minute window or so that he was going to be gone doing that. Now they did look at her phone and they seen where she had kind of mapped out his route and how long it was going to take. This is where the pre-planning comes in, that the prosecution is saying that
Yes.
she pre-planned this, that she went ahead and she actually had it on her phone where she was getting the time, how long it was going to take to make sure she had the time to do what she was doing. So they're saying this is pre-planned. This is why they're not saying she was totally psychotic. She knew what she was doing, to my understanding. So her husband didn't see it. No. So that's how her husband wasn't there. And then in that process, her husband calls her, tells her that, I guess her husband calls her to tell her that he couldn't find the stool softener for the kids or something to that effect. And then he goes and picks up the food, to my understanding, or something close to that, picks up the food, starts to head home, tries to call her. She's not answering. It's when he comes home. He goes upstairs. He calls for his wife. He doesn't hear anything. Everything's super quiet. He goes upstairs, opens the door. He sees there's some red stuff everywhere. And then he noticed that the window's open, goes and looks, and sees her outside the window on the ground head first, that she had landed apparently. So he then goes down there, obviously, and she's still alive. He asks her where the kids are. She tells him the basement. So when he goes to the basement, that's when he notices the kids two are together and one are in a different spot in the basement, and they're all unalived. So that's kind of how I interpreted and read it. Is that fair to say, Doug?
Yeah, that's Patrick's narrative and story. But
Okay.
There's one problem in there.
Okay, go ahead.
And that is the fact that she said anything.
Right.
With the condition that she was in, I don't believe there was any way she would have even been able to speak. So
good point.
That's the first point of contention. And there is a lot of people that think, I'm just going to throw it, there's a lot of conspiracy theories that think that Lindsay didn't even do it. They think it was all Patrick and he framed her for it all.
Got you.
And then there's people that think that, well, maybe she did it to the kids, but Patrick did the things to her, as far as the slashing and the going out of the window and all of that stuff. So they're just trying to figure out what actually happened and the timeline, and even some of the internet searches. They proved that some of the searches on her phone were actually done by Patrick and not by Lindsay, because she wasn't even home at the time, and they were done on the home computer.
That is correct. I did read that. Yep.
And there's the nuance that Patrick is actually her proxy, and he just wasn't paying attention. I mean, at certain points, and then there's other points where he was actually having solo conversations with her doctors, being the proxy without her knowledge of it.
Makes a lot of sense.
Some of her pills were found in his car.
Yep.
Her DNA is not on the bands or on the knife. I mean, neither is his, but it's just a lot to get through. It's a very, very crazy case.
Yeah, I wasn't even there yet. Yeah, no doubt. Yeah, having no evidence on the knife of fingerprints or anything on either or is kind of odd. You know, it's really, really odd. I mean, that's a red flag big time, you know, and that they didn't have anyone. Now, if you would ask the question, okay, so she apparently, as it is appears, not that it happened this way, but she's on the ground laying from apparently coming out of that second story house. Okay, she's on the ground. That week, that they said that's what they found her. Okay, now here's the kicker. If someone doesn't have fingerprints on a knife, for better lack of words, that was probably used, okay, you have to ask yourself the question: if she didn't have fingerprints from her on that knife, I highly doubt that she would have grabbed a rag or a glove or something to wrap around it as she used it. She wouldn't have been in her right mind if that was the case, right? It'd be hard to envision somebody who has all these medications or who is going to try to unalive herself to make sure she doesn't show anything. I think that's the least thing she's going to want to do. On the other aspect, as Doug was saying, it is very possible that if someone was going to do this, they would make sure, if they were sane and not on any type of medication, that they would make sure their fingerprints were not on there. So you have to look at also from that perspective, because that speaks volume. If I am going to unalive myself, I'm not going to give two iotas about my fingerprints being on a tool that I used, right? It just doesn't make any sense.
Correct.
And if I'm sober and I'm the one coming home and I'm the one that supposedly found this, and I would have the opportunity to make it look a certain way because you're in your right mind. You know what I'm saying? So you just got to look at those little things, because those little things sometimes answers the question that people really have. So that's how I would look at that. Very good point, Doug. Very good point. April says, I am not set up to do a panel yet. Maybe in future. You got it, April. No worries. I need a mic because on a computer. I do have a laptop set up, but don't have it right now. You got it, April. No worries. L, if she went to get help, the signs were there. They simply weren't giving her the help she needed or weren't taking her seriously. So the idea that she probably wasn't being taken seriously is probably because of the fact, I don't think it was that. I just think that there was no communication. Honestly, I think there was no communication between the psychiatrists and the doctors and whatnot. It was almost like, no, it almost seemed to me, and I could be totally wrong, but in my opinion, it almost seemed to me like they didn't want to take anybody's word on what this lady has, because when they issue you some high dose medication, some psychotic medication, I mean, normally they would talk to each other, but I have known people that have literally, doctors that have literally shied away from taking anybody else's opinion rather than their own. You know what I'm saying? They're going to want to just, if they're going to issue something so serious, they're going to make sure that they diagnose the person and they're going to give them what they think rather than rely on somebody else who gave them something. When in reality, all that really does is shows you that whatever she was given in the past wasn't working, or it was working, either or. And that's why it's important to have that information and to get that information. That's why when you go to the doctors today, they always ask you, are you taking any other medications? Are you taking any other, this, that, or the other? Have you seen any doctors before this? They'll ask you these questions because they want to make sure they do their diligence to know if in fact you're getting other not narcotics, but other drugs, especially when they're that strong. These drugs that she was given, 13 different drugs, in 4 months, and different types of drugs, that's a lot. And I know these drugs, that's a lot. And that drugs do have a lot of side effects, to say the least. So we'll cover that here in a little bit. FinFan, hi, hey, Devil Dog 88, welcome in, FinFan, good to have you. Melly, if Lindsay was repeatedly asking for help, at what point should outpatient treatment have become inpatient psychiatric treatment? Well, her husband if he felt she was could have hurt herself, or feared that she was going to hurt herself by maybe some of the comments that she had made along the way, then her husband could have helped get her in a clinic, for a better lack of words, to get help in a psychiatric hospital, along with a psychiatrist. If they felt that she was going to do harm to herself or others, they definitely could have immediately recommended she go to a psychiatric hospital, which obviously they would have talked to her husband and, they would have worked that out. The fact that she didn't, Melly, that she didn't receive it makes me wonder, why did she? And you're spot on. I'm not sure why they did not put her in there, other than at the time that they were diagnosing her, they didn't believe that it raised to that level, which, hearing what I'm hearing and reading what I'm reading, I think they were already past that level, in my opinion. But that's just my opinion. But that's a very good point, Melly. Very good point. April L. Yeah, she told her husband and her mother both she was thinking of harming the children. And then that's it right there. At that point, they could have got her admitted in with that. Well said, April. They could have got her admitted. That's all they needed to get her admitted and get her some help. They wouldn't have denied her because she has stated, if she stated that to them and they were willing to go in there and say, this is what she told us, we're really concerned, they should have did something without a doubt. In my opinion. In my opinion. FinFan, 1985, Millie, 007, L. Even if her insurance is good, they still have guidelines, and guidelines are too strict. Just because you don't have an active plan at the moment doesn't mean that thoughts aren't in your head and you. Yeah, I did that, L, without a doubt. Good point. Good point. L, can't snap. L, this is something I feel very strongly about, guys. Sorry, because I worked in mental health prior to getting in, saw it day in and day out. No, you're right. You're spot on. Yeah, you're spot on. That's a very good point. No doubt about it. April, understandable. L, this could have been prevented. So sad. Lake, welcome in, Lake. Welcome in. That was the first mistake, Dr. Hopping. Yeah. Yeah, when you do that, but here's the thing. If you are the person that's going through all this and they're giving you certain things and then they're changing it because you're telling them it's not working, and then you start bouncing around, that's only a plan for disaster because it's like, some of these medications take a while to kick in. They don't kick in right away. They take a while, and they have to get in your system and been in your system for, some say, 2 to 3 weeks before it really starts to take hold. Okay. Now, that's a very good point. So if she's not seeing the immediate effect that she's feeling better, she decides to go to some other doctor or some other psychiatrist, I can assure you they're going to ask who she went to or if she's been to anybody else. Whether she tells them or not, that's a different story. But the idea that she's trying to find for better lack of words, in my opinion, a peace, so she doesn't have these thoughts. She doesn't feel this way. It's very probable that there was just too many different medications coming in and exchanging them and taking them out. It's normal to get, for example, medication as in, let's just say, Seroquel. Okay, it's very strong. Seroquel is very strong. It's definitely possible to take a Seroquel and it does nothing for you other than those side effects kick in. I mean, those side effects kick in big time. So it is possible that she didn't wait long enough for that to really take a hold and then went and said, man, I'm still feeling like this after a week or two or whatever, and then they say, well, let's take her off of Seroquel and let's try Trazodone, or let's take her off of Trazodone and let's try, whatever, the key is, the whole point of it is that it takes time to take effect in your system. It doesn't happen in 3-4 days, a week. Sometimes it takes longer. And it just depends on the person itself. So that is a possibility that could have played a role in it as well, without a doubt. Miss Barney, pharmacy, check to see if any meds can interact badly together if only one pharmacy is used. Very true, Barney. Good point. April, my focus has been why no intervention from doctor, husband, and family after what she told them. The children could have been saved. Very good point, April. Very good point. Carol, I meant her husband didn't see the signs of her mental health. He did see the signs because he said as much. I mean, if she's telling him, in my opinion, and I can't say he saw the signs, but in my opinion, if she's telling him she wants to hurt the children or hurt herself, I don't know what other sign you need. I really don't. I don't know what other sign you need. You confirm it, you take her in, or you make sure you know without a shadow of a doubt that she's not really, for better lack of words, you verify that to yourself, because if you don't, this is what happens, and then you are also in some way maybe not held accountable, but you are somewhat responsible as well. In my opinion, like bipolar people should be prescribed benzos. Yeah, I know there's a lot of things out there for people with bipolar, and it just really depends on what works for their body. I know that there's a lot of things that don't work for certain people that work for others. So what they have to do is they have to try, and when you go and they ask you, you see your psychiatrist and they say, how's the medicine working? Well, it's really not working. I'm still having these dreams. I'm still having these nightmares. I'm still having these intrusive thoughts, about hurting my kids, or hurting myself, or hurting others. Then they're going to go, okay, well, now they're going to document all that because they're your psychiatrist, and they're going to say, well, okay, let's try this medication instead of that medication. Let's see if that works. Problem is, a lot of times they'll say, we'll see you back in about a month. If you're at the VA, they'll say, we'll see you back in 6 months. Well, hell, So I don't know what was said. I just know that there is a lot of times when they have to keep trying until they find that one that corresponds with your body. Carol, he had her meds in his car that he was removing, that he said she wouldn't take. He knew. Yeah, he definitely knew. In my opinion, that would mean such. Pam, hey, Lake Life. Pam, hey, Song. Hi, Pam. Carol, Lake, I have personally experienced with higher up nurses, psychiatrists don't listen. One of my clients poked himself in the chest with a poker. His winter coat saved his life. Interesting, Lake. Thank you for sharing that, without a doubt. Hi, Pam. Miss Barney, I used to count my husband's medications. There you go. Pam, why didn't the doctors not take more concern and get more help, possibly removed from the kids until she was more stable? I agree. I don't know the conversations that were talked about between her and her psychiatrist and her doctors. I don't know what was stated. It's a good, valid point. Why not, take her away from that situation? And the best really place is to get her admitted and get some help. However, you go from being very strong and very a person who, is by accounts of a lot of people, that she was very loving. She was very heartwarming to her kids. She loved her kids. She spent a lot of good times with her kids. And then all of a sudden she has her third child, and that third child then starts to have that postpartum depression or psychosis. And at that point, now she's trying to figure out, why is she feeling like this? And then they put her on medications to try to help. And there's a lot of times when that medication really doesn't help. It hurts you more than it helps you, depending, unless you're on the right medication. Every medication doesn't work the same for everyone. They're all different. Song, I'm bipolar. I have been non-medicated for 5 years. I am 59. This has been the most sane time of my life. This had been the most same time of my life. The prescriptions, meds, always made everything worse. Meds don't work for everyone. That's 100% true. It's 100% true. It don't work for everybody. Everybody's bodies are different and reacts differently. April, it just makes me so mad and sad that no one removed the kids after the testimonies given in court. Yeah, and when they're given in court, everything becomes more realized, right? You realize more like what the heck is really going on, right? Everybody's under oath, and they're telling you. It's almost like hearing their heart and soul of what was going on, what they were thinking, what they were saying, and that's an eye opener. And then, yeah, like you said, then you ask the question, why did no one do this? Very true. April, it is extremely sad. Lake life, psychotropic drugs can be very dangerous. People have to be monitored very close. Yeah, no doubt. Good point, Lake. A song. It's just also very sad. My heart goes out to those babies and family. Well said, song. Well said. Barney, the brands used on the children would most likely have fingerprints. They are made with rubber. The bands used on the children would most likely have fingerprints. They are made with right, but they didn't. I don't know if the bands did. I know the tool that she used on herself didn't have anything. I'm not sure if the bands did or not. Doug, did you know if the bands had any fingerprints on the bands by any chance?
No fingerprints on the bands or the other tool.
Got you.
There's
Okay.
DNA, but it's not hers.
Right. Well, thank you so much. I appreciate that.
Yes.
So now there is no ban. Doug's been following this, and he says there was no no fingerprints discovered on the band. There was DNA, but not hers, as well as the tool that she used to take her own life. Welcome in, Bruce. Welcome in. So there is no fingerprints on anything, which then makes you wonder, what does she do? Did she take something and wrap around her hands and till she wouldn't leave any fingerprints on those bands? Do you think somebody who is on medication and is going through all this would be thinking about that? I don't know. But I know it's a damn good question to ask. How and why would she even think of concealing her fingerprints if in fact there was nothing there? You know what I'm saying? She's not going to conceal that, I don't think, logically, especially when she's on medication. But then again, I don't know that to be fact, but it would make sense to me. It'd make all the common sense to me. Now, could somebody else have done this and wrapped something around their hand and then done this and then take the stuff off, whether it's gloves or whatever? That's very possible. So I can see where the theory is going, where the shifting of the believability of her, what she was going through, and did she do all this because she can't remember anything, or was it someone else that did this? And that's you got to look at that if you got an open mind and ask yourself, is that possible? I would say, hell yeah, that's possible, in my opinion. So my pharmacist looked at my list of drugs and said, if you take this, you will become unalive. Yeah, yeah, that's a tough one because your pharmacists are supposed to have the best interest, but if he had his choice, I think he would probably be a doctor over a pharmacist. So I guess you got to really just trust what the doctors tell you, unless you have reason to believe that they don't know what they're talking about. At which point, then you wouldn't be seeing them. So that's interesting. Bruce, hi Doug, hi Didi, Doug, everyone, good morning. Welcome in, my friend. Lake, stupidity on the doctors and the therapist part. Good point, Lake. Good point. Pam, true song. My brother got on drugs, messed his mind up until we got him in place where they could test him, and get him on the right meds. He's doing great now, but he will never be to live alone. And yeah, that's what these places are. That's what they do. They have a way of keeping you safe to the best of their ability. And then in that same process, you're seeing a psychiatrist there that is prescribing things and trying to get you on that right medication. That's very true. And sometimes it works. And then sometimes, the person just, for a better lack of words of what I've heard in the past, will play the game just to get out of there as soon as they can. It really just depends. Pam, hey Bruce, FinFan, click that like, everybody. Click that like, subscribe, and share the channel. Barney, hey Bruce. Lake, 1985, Melly, hi Bruce. Good morning, friend. Carol, hello, Lake. Song, glad to hear he's doing okay, Pam. L, I have to look into this case a bit more, but it sounds like many failed her at the kids, in my opinion. Without a doubt, L. I mean, after I read all this stuff that I read, it came to me, it made me literally come to that conclusion that what you just said, in my opinion, that literally this lady could have been failed big time. And it definitely, her and her kids, it looks like they could have been failed by the doctors and psychiatrists, without a doubt. Just my opinion. FinFan, Bruce, what up? Bruce Davis, hi Melly, hi Barney, Bruce, hi FinFan. Bruce, nothing, FinFan, just trying to have a nice day. FinFan, thank you for always supporting the channel, my friend. Appreciate you. Carol, hello. FinFan, hi Carol. Song, DD, I learned early on to never let anyone know if I'm feeling really bad, and to always downplay my symptoms to doctors, so I am never put into a psych ward. How sad is that? I had to do that. Right. I get it, Song. I know a lot of people like that. A lot of people like that will downplay what they're going through just so that, no one will take their kids away, or no one will go ahead and try to admit them in a facility. And you're right. And then what happens? You never get the help that you need. You never get the help that you need, because all of a sudden you're put in that category, and for a better lack of words, you are put in that category that you're crazy and you cannot be trusted. And no one wants to have people looking at them like that, without a doubt. Very good point, Song. Very good point. L, thank you for supporting the channel, FinFan. Lake, working in the mental health field, I've seen over and over again the ignorance of psychiatrists and other medical staff. I quit because of that. I can understand that, Lake. Totally can understand that. Song, that is good. My insurance does that. And until they feel I need the meds, they won't pay for the meds that they think aren't good for me. Yeah, that's the sad part, because even if a doctor thinks they're good for you, or they will only help you, you never get to see that until the insurance company decides. Kind of backward ass, if you ask me. April, she was in and out of the hospital quite a few times, but released. Lake, FinFan. Interesting, April. Melly, please hit the likes and sub, everybody. Do me that favor. A song in my heart says, my husband and daughter are a huge support to me now. They are my safe place. I can tell them I'm not having a good day, and they are very supportive. That is awesome. And when you have that, I mean, that's spot on. Hey, Lay, go Cardinals, says FinFan. Bruce Davis, there's Echo. Bruce Davis, hi Lake, hi Bruce, hi Song, Chris, hey Doug, can you mute for a minute? Hey Doug, can you mute for a minute? Says Chris. If no one is listening to you, you seek help elsewhere, in my opinion, but it causes confusion and lines to get crossed. Let's see here. Copy. There is a link. There it is. Kiki Khan, postpartum depression has been around for hundreds of years. Why can't Big Pharma develop a specific drug and extra care and follow up? Yeah, no doubt. I don't hear any echoing at all, Bruce. And I think Doug is muted right now. So do you guys hear me echoing? Because I don't hear me echoing. Let me know. Thank you. Hi, Chris. Song. In the shitty side of facts. There you go, buddy.
Hey, what's up, Double Dog?
What's
How you
going
doing?
on, buddy? In the
Hey.
shitty side of, go ahead.
Okay, I was just gonna ask you. So, what drugs was this lady on? I seen some things a little bit ago, on the news, but I didn't. It was just like it caught towards the end. There was some pills or something at her trial, or they were showing a bunch of medicine.
Yeah, she was on, I believe, 13 different medicines.
Oh my God!
Yeah, everything from,
Mm.
I'm looking for it right now, but everything from trazodone to, I believe, Valium to
Trazodone, Valium, isn't that stuff for mental illness
Yep.
medication?
Yep.
Oh boy!
Uh,
So they whack these people out of their mind.
I don't know what they did. I just know that that's what they said, that she was on that many. I mean, she apparently struggled with insomnia, anxiety, medications, fear that she was becoming dependent on medication. There's so many different things because this case is so out there, and I'm trying to find that list that tells me what exactly she was on. Do you know
I'll
offhand?
tell you. Man.
Do I sound?
Yeah,
am I still squeaky?
You don't sound
No.
squeaky.
All right, so let me give a little bit.
Okay,
I'll
go ahead.
go over some of the drugs in the beginning. So
Okay.
back in 2015, when Lindsay was in nursing school, she suffered from anxiety and stuff, and they had put her on Prozac and Wellbutrin.
Okay.
And at the time, she reported no side effects. They worked great. So later on in, 2022, after she had Callan, is when she started seeing Dr. Tufts. Dr. Tufts' initial drug report was for her to start the Zoloft, which she chose over the Prozac, even though the Prozac didn't have side effects because she was breastfeeding, and it was better for the baby for her to be on the Zoloft over the Prozac. And then she introduced Ativan for sleep and Benadryl for sleep. But the Ativan wasn't supposed to be taken like on a regimen. It was for severe spouts of anxiety or insomnia. And what they're saying is because she didn't have the bipolar diagnosis yet, the Ativan should have never been introduced, because that should never be introduced to somebody with bipolar, because it can cause the erratic ups and downs. Like when you're on it, you're great. But then when you wake up in the morning, you experience the most severe symptoms because you don't have the Ativan in your system anymore.
Right.
Coupled with the Benadryl. So that was her initial thing. And then she realized that she didn't like the Zoloft, and she thought she was becoming addicted to the benzos. That's when she switched doctors. And that doctor told her to stop taking the Ativan and the Benadryl, and that's when the trazodone was introduced. So then she tried that with the Zoloft. And remind you, she's not taking the Zoloft really as she's supposed to. She would do it for like a week, and then she stopped, and then she would try it again, and then when she increases, when it became very severe. So then now she's on Dr. 2 with the second list of drugs. And then about a month later is when she goes to the emergency room, and that's when the Seroquel was introduced to replace
Doug.
the benzos and the
go ahead.
Benadryl, but still with the Zoloft. And then there was a time where they told her to go to the Women's and Infants. They had a program, and at that time they said that she didn't fit the criteria because she was over medicated. So that would have been an inpatient program, but she was disqualified because she was over medicated, they told her. So then when she goes to the emergency room, is the emergency room doctor introduced the Seroquel. I think I already said that, but that's where the Seroquel came into play. But she still has all these other drugs and could have been taking them for the different degrees of the symptomology. But at all these visits, she's telling the doctors what her symptoms are, and they're not working. They're making it worse. And the big thing was the benzos being introduced because of the misdiagnoses. So that's like the first 3 doctors that she had seen, how all the different medications. It's not like she was on 13 all at the same time. Each time there was supposed to be 3 different drugs, a mood stabilizer, a benzo, and a sleeping type agent. So there was different plans, but she couldn't follow the plan long enough for them to actually work. And none of
Right,
these
yeah.
doctors ever did a hemoglobin test. She never at one point through all of this got a blood test. So that's also
Doug,
another problem in the practice, I believe.
Doug, but let's be honest. When you keep filling these people full of all the, look, I'm not saying I'm not a doctor, but I'll tell you something I've seen. All right. I myself went into, because I've got gastritis. And you know what they do? They want to fill you up with pain medicine, right? I had a doctor give me 10. He gave me 10 shots because I'm a bigger man, right? He said, well, you're a bigger guy, so we have to give you a little more. But look, it helped me. But I'll tell you something. I don't remember. All I remember is getting wheeled out from my dad. My dad wheeling me out. And I didn't even know who the hell my dad was. I was so loaded up on drugs. So these drugs that they're given, and I'm not talking pain medicine, we're talking about mental health drugs. This is a lot of the problem. They're filling these people up with so much crap that these people are doing horrific things, as we see as right now, as children dead. That's causing a lot of this problem. These people, they choose themselves. Obviously, this lady chose not to get herself help, but it doesn't help when you go to so many different doctors. And the ER, that they can give you some stuff. They're like a Band-Aid, but you have to go to a regular person, your own personal doctor, right, to get your medications, to have a doctor that works with you to get you things. I don't know if this lady, doesn't sound like she did that. Maybe I'm wrong. I don't know. But they've got her on 13 different kind of pills. These people fill them up. They're going to get whacked out. I'm just saying. And you know, it hurts me that there's children dead.
So true. Well said.
Mm-hmm.
Well said. That is well said.
And thanks a lot, Doug, for since I asked that and you answered everything. I appreciate it. Double dog, you too.
You got it.
Because I just seen a couple bottles. I didn't know this lady was on a whole bunch, so I do appreciate things.
Absolutely, bud. So go ahead, Doug. Continue where you were at.
Yeah, so now we're at the time when she goes to the emergency room and now she's starting on the Seroquel.
Mm-hmm.
But the Seroquel really like intensifies everything, and she really doesn't like the Seroquel. So she goes back to doctor number 2. And that's when they says, all right, we're going to try you back on Valium now. And that's when she gets the Valium. So now she's doing the Zoloft, Valium, and Trazodone. And that didn't work either. But she really did like the benzos. At no time did she stop taking the benzos. The benzos were always part of it because they were the ones that made her feel good when she took them, like immediately. Like she took them and she felt better. And the defense is saying, but they shouldn't have never been part of the script because she actually has bipolar that was undiagnosed by the doctors. And then later on around, I think it was in November around Thanksgiving is when she actually does check herself into a facility and she spends 4 days there. And that's when they put her on, I believe it was the amitriptyline. It's like a shot.
Right.
But she was supposed to stay longer. But she ends up checking herself out because it was Cora's birthday coming up and she had to plan the birthday party. So she checks herself out of the facility. And then 4 days later, she goes back to the doctor. And that's when they put her on, I believe it was the amitriptyline. It's like a shot. But she was supposed to stay longer. But she ends up checking herself out because it was Cora's birthday coming up and she had to plan the birthday party. So she checks herself out of the facility. and plans his birthday party. And that's when all the family was present and started seeing all the changes in her, like that she was disassociated, she was kind of distant, almost like unemotional, but she was still doing everything that she needed to do. She was still cooking, cleaning, taking care of the kids, giving them baths, reading them books, like doing all the things that a mother would do. She's still trying to be a good mother. And that's what confused Patrick. She would be saying one thing, but then her actions would say something different. So he just, that was his claim. Like, he just didn't understand. He was confused. Like, she was saying one thing, but demonstrating different things. And I think there was a big disconnect there.
Right. Interesting.
And then it just got worse from Thanksgiving. That's when it really started. That's when she started telling her parents about thoughts about hurting the kids, and telling Patrick thoughts about hurting herself and possibly hurting the kids. And that's later on in December is when she starts doing the suicide hotlines. Over like a week period, she had called twice, and they didn't intervene because she didn't have a plan. Right. While continually taking all these drugs and getting worse and worse and worse every day. Until we get to the day of the incident.
Okay. Keep going.
So yeah. So they're claiming that it's the doctors and the drugs, and everybody else just, they missed the signs, and there was misdiagnoses, and that all the doctors were just making it worse. So that's where it's at right now.
And that's the thing. I mean, when you look at this case, like I said, I've just started to even begin to understand and follow this case. But, you know, when I hear 13 different drugs, and a lot of them are very strong, you know, from Seroquel and on to Zoloft and everything else, there is a lot of side effects that go with it. You know, and there's a reason why they tell you, you know, if you exhibit any of these side effects, you know, let your doctor know, or, you know, let them know right away, because that shouldn't be happening. It may happen, but it shouldn't be happening. If it's happening, that they could get you on a different drug that won't really correspond that way with you. So, or they'll keep going until they find the actual drug that works best for you, because everybody's different. And that's usually how it works. But in this case, you think that there was enough signs, enough forethought to go ahead and get this lady admitted, to get her some help. I mean, I don't know how you go from being who she was and what profession she had to something like where she is at now. That doesn't make sense to me. You know what I mean? It just, you know, I mean, granted, you know, that postpartum, you know, that does a lot of things to a lot of women, but it just sounds crazy. It just sounds like not enough was done to take her and put her and get her some help. Like they just let it seem like it was just going to be, you know, she'll figure it out. You know what I mean? That's what it seems like, that she'll figure it out. And that's not good. That's not good. That is not good at all. Because now you have 3 innocent little kids that are literally no longer with us, and you have families that are destroyed because of it. And it's just crazy. Thank you a lot for that. Late potassium and B12 here, April. Like any other meds, I tell you them, hell no. Miss Barney, my own doctor thought I hadn't had a COVID shot and started to rip me a new one. Now my doctor politely says you don't have to take anything you don't want. Bruce, April, I've got 25 years clean and sober. Don't take pain medicine unless they don't just want to enjoy life on blood pressure pills, gastric meds. Barney, no echo, no echo, no echo, no echo. Trazodone also used to sleep. Yes. Yes, it is. Good for you, Bruce. Bruce, thanks, Fin Fan. My body felt better. So happy I got my health problem, but no drinking or drugs. Fin Fan, that's great, buddy. Kiki Khan, she was also self-medication with alcohol and gummies. That's a definitely no brainer. You don't mix alcohol with your meds because I mean it's just you're not asking. That's asking for trouble, I guess, is my opinion. It's just not normal. And the how they both react to one another, yeah, you're going to get that big time. And morning, took them both awful. I quit. Oh, hello, Truth Warrior. Howdy, y'all. Annie, hi. Double Dog, Kiki Khan. Hi, Truth Warrior. Millie, I am shaking my head knowing she was declined inpatient care because she was too overly medicated. Did anyone not think to report this and look into why she was being so? I mean, it's just common sense, Millie. That's well said. It's very common sense, and you think these people would have figured that out, but for whatever reasons, I don't know. That's a very good question. Any new tablets? Gotta figure this out. Oh my God, never had blood test. Says L. Melly, hey, Truth. Melly, hey, Marianne. Carol, exactly.
Can I say one thing about that real
Absolutely.
quick, Todd?
Go ahead.
So
Absolutely.
the when she goes to the Women's and Children program, which was recommended by the psychiatrist, and they tell her that we're not accepting you because you're over medicated. All the doctors that were prescribing the drugs had no idea until they were told at the trial that that's the reason why she wasn't accepted into that program. So it's just another disconnect where doctors and facilities aren't speaking with each other.
That is crazy. That is literally crazy.
Yeah, it's just something you would think your psychiatrist
Absolutely
would need. And it's not that they didn't know she didn't go. They knew that she went and they knew that she was disqualified, but there was no follow-up. Wow. They didn't look into the records to see what the reason for it was. Instead, they just threw more pills at her.
Right.
So there's that.
No, that's huge. That once again, it goes back to communication, right? Everything's about communication. Everything's about communication. And if you don't communicate in anything, whatever you're trying to do, whatever you're trying to figure out, whatever you're trying to accomplish, it will all fail if you do not communicate in anything you do, even your health. Or even in this case, doctors and psychiatrists not doing their communicating with one another causes other people to lose their lives, in my opinion. FinFan says it's all about the money to them. And repeat patients. What about doctors' oath of patients' well-being? Well said, FinFan. Live. This is a classic example of system failing a patient. Without a doubt. Well said. April, yes, I don't get that at all. Any doctors are terrible these days. Send you all over. I can see for something all over. I can see for something, but they just send you a network. No more private doctors.
Devil Dog. So,
yeah. Go ahead.
I'm sorry, I mean to interrupt.
Go ahead.
So is this lady in trial, or has she been found guilty, or what? What's
she's in trial. She's in trial right now.
Okay.
Mm-hmm. And it's on TV too.
Oh, it's on TV too.
Mm-hmm.
What station is it?
Oh God, I think it's going to be like, what is that, Doug?
Law and crime is covering it.
Law and crime.
Oh, Law and
Okay.
Crime. Okay. I don't know
Melly,
if
exactly, Finn. L. Lake. Melly, it's crazy. Hi, Bruce. Good to see you. Hope you are having a good morning. Devil Dog, sorry to hear that. Lake, Trazodone, and Valium, a combo for disaster. I agree. I'm not one that Trazodone is something that I can take without a doubt.
yeah.
I can't do Trazodone. There's just something about it. Devil Dog, right?
They
Go ahead.
they gave me like a little bit. I think it was a little bit of that. It was they gave me some nausea stuff. They gave me a whole bunch of pain medicine, and then they gave me a little shot of Trazodone to ease my body so I could rest.
Mhm.
And I'll tell you something, I didn't even like taking that stuff. It felt nasty, even when I was sick.
Yep.
Oh, sweet.
Yep. I agree, buddy. I agree 100%.
I don't really do anything. So, I take the medicine I have to take, my diabetes stuff, my blood pressure, but unless I have to, no, I will not be touching any kind of narcotic drugs from a doctor or nothing. I tell them, no, you want to give me something, you can give me some Tylenol or something, but I'm not
Right.
I'm not going to be touching under your,
Yeah.
because it just, to me, is, look, I look, maybe it's just me now because if I didn't have a wife or didn't give a damn like years and years ago, okay, that's one thing, but to be locked up on stuff like that, and that's what's happened to this lady. And we have a total disaster of children dead. I believe the husband too, right? Isn't the husband dead too?
No.
I mean, a whole family just like that. It's a shame.
Yeah, it is very big shame, no doubt about it, bud. Well said, well said. Fin fan, they won't repeat. Patients like drug dealers want you to come back or hop to the next Dr. Farm in billion-dollar industry. No doubt. Lake, exactly, says Melly. Fin fan, my opinion. Double Dog, True April. L, well, there's a saliva test that can be done. There's a saliva test that can be done to show what works best for you. Why wasn't that done? Yeah, no doubt. I didn't even know that there was that kind of test, but yeah, if there is, why wasn't that done? Very good point. Pam, hi Annie. Annie, hi Pam, Melly, Finn, Lake. My mom used to call her Valium Mother's Little Helper. That's cute. Mother's Little Helper. Fin Fan, thanks Melly. Devil Dog, interesting April. Barney, what type of plan was she supposed to make? I have no clue. Gene, welcome in. Hi, Dee. Hi, Gene. Good to have you. L, if they had run the test that helps show what works best with your body chemistry, that definitely could have helped. That, along with no blood test at all, is mind-boggling, in my opinion. Oh, I agree. Well said, Al. Well said. Lake, after my experience, I will never go to another neurologist ever again. Hi, Gene, says Al. Carol, hello. Gene, good morning, DD, Maz, and chat. Welcome. Melly, when I started my meds for severe anxiety and depression after my dad passed, I was monitored very, very closely because the side effects can be awful, without a doubt. And that's the problem with a lot of these meds, man. I know I used to take it for granted and not think anything, like, oh, the side effects, yeah, whatever. But I tell you what, those side effects, they're no joke, man. They are no joke on some of these meds anyway. You get sent to the doctor, to another doctor, to another doctor. At the end of the day, you have some meds, you're confused. Annie, if you go to like we have stairways went for 18 years, but couldn't let them pump up meds. Interesting. L, they will only admit you if you're entirely actively wanting to self-alive at that time. If you were 3 hours ago, it's not criteria to keep you. I kid you not. You can't make this stuff up. Well said, L. Right. Right, Miss Barney. I'm going to unalive someone. I'm not telling anyone my plan. Fin Melly, I'm so sorry. Carol, Melly, for sure, hon. Jean, hello. Great to see you again.
Well, I actually don't know, but I tried to be honest. I tried to be honest with people. I don't know a whole lot about this thing because we've been watching the Nancy Guthrie case.
Right.
There's a lot of cases going on, and it's like I'm supposed to know everything. Like I don't. These guys know. I'm just honest about it. I don't know. You're damn right I don't know. But you learn. But you don't have to make smart ass comments towards me like I don't know what's going on. I mean that's kind of childish, really.
Who said
somebody in the chat. It's all right. It's cool.
Gotcha.
It's cool. Let them talk, whatever. I don't give a damn.
All right. Melly, been following the case, and I have very mixed feelings about it, says Jean. Totally can understand that. Melly, Carol, some of the side effects were awful, and I wanted to quit the first week. That's why having a good doctor and not a million is so crucial. Fin no bueno. Fin, exactly, Melly. Carol, I understand, Melly. I'm just glad you are doing great. Pam, hi, Jean. Annie, some of these hospitals don't even want to take you since the COVID is awful. Melly, love you too, Carol. Annie, bless you, Melly. L, with technology, it's pretty much all medical facilities interconnected. Now I don't know what they see how they see these things. It's easy to communicate now that it's once was. Carol, you welcome, Melly, Annie, April. I have one doctor, one dermatologist, and one eye doctor. My primary doctor knows all the others, gets reports, and even my chiropractor. They have sent him everything. Like I said, he is intrusive. That's awesome. That's awesome, April. You're in good hands. Fin. It's live, Bruce. L, if you've seen a new doctor, they're supposed to read you referral chart, but they don't always do that, and it becomes clear when they do not, in my opinion. Gene, trazodone made me sleepwalk. Can't take it. Oh, yuck. I agree 110% with that, Gene. Well said. Annie, I do take one med since my daughter was taken. I can understand that. Gas. You can't tell some people don't know what is going on in this world. And he's on this show this morning. Fin, it's on like 8 YouTube channels, Bruce. Melly, that's scary, Gene. Bruce, Gas, who you saying don't know what's going on? Good morning from southern Wyoming. Miss Barney, saliva test. Can you tell us more, please? L, Gas. April, I removed his comment. Let's move on next. He will be timed out. L, Barney, they help doctors reduce trial and errors by sorting medication into categories based on genetic makeup. It's cheek swab, saliva test. Yes, this Bruce doesn't know anything about this case, and it's been on most of the streaming services. Fin, Gas, April, thanks, L, Lake, thanks, 1985, L, Gene, Melly, yes, it's scary. I called and worked while sleepwalking. Told him I wouldn't be there. I thought that I found out later I never called them after sleep study, and that's why I was prescribed trazodone. Oh, wow. Trazodone not supposed to be taken in the daytime anyway. It's supposed to be taken when you go to bed. It's supposed to relax you so you can sleep. Then you aren't supposed to take, but very low dosage. All I know is I took what my doctor gave me and I did not like it. I did not like how I felt when I woke up. I was very lethargic. Lake, this case makes me livid. April, Bruce, no worries. He is gone. April, respected these chatters and panel or risk timeout. Thank you, April. Pam, 100% says L. Melly, Jean, I'm so glad. I'm so glad you're okay and you noticed that it wasn't normal. Late trazodone caused my pit to have severe breathing issues. Had to rush her to the vet. Bruce, I'll just be in chat listening. Come up anytime, Bruce. L, Lake, that must have been very scary. April, Bruce, you are fine on panel. Just a troll had nothing better to do. Lake, Bruce, please comment. The hater can kick rocks. Carol, Bruce, you're good. Don't listen to the jerks, hun. Lake, it was L. Miss Barney, problem for me is that the lie that I live alone. No one checks on me. And I get off track with some of my medication at times. Totally understand, Barney. I know it's okay. I'm listening. I'm eating my breakfast. L, Bruce, we thinking of you're awesome. Love having you on the panel. Pam, but also patients go to doctors. They need to show all the mods they take and the doctors they go to, because some people go to many doctors to get all their meds. Gene, I am 84 years old. 3 years ago, I stopped Celexa. The only man I was taking and stopping that fuse. No more psych meds at all. I only prefer psychologist play, cannot prescribe meds. Awesome, Gene. Bruce, thanks, L. Appreciate you all. L, okay, Bruce, enjoy your breakfast. Annie, trazodone was awful for me. I was awake, dreaming, and saliva running down corners of my mouth. I know the feeling, Annie. I know that feeling. Bruce, Gene, you're same age, Miss Nancy. God bless you, Gene. Bruce, Davis, thanks, L. So that's in a nutshell. Now, I don't know if anybody ever had metrizapine, but that's another one that's kind of one of those that really truly kicks you in the what. So getting back, that's what's basically the case is about. And to try to understand, I mean, here's a list of, according to the testimony from her family and evidence introduced at trial, she experienced increasingly severe. Now listen to this for a minute. Anxiety. This is what she experienced. Anxiety, depression, insomnia, intrusive thoughts, suicidal thoughts, fear that something was wrong with her, fear concerning her ability to care for her children, increasingly disturbing thoughts. She sought out a psychiatrist's treatment and was prescribed multiple medications. The defense says this was the beginning of the postpartum psychosis, compounded by undiagnosed bipolar disorder and medication problems. The prosecution says that doesn't deny that Lindsay was struggling. They don't deny that she was struggling with her psychologically. Its argument is much narrower. She was mentally ill but she was not legally insane when she unalived the children. That's what's really about on this trial. They're not saying she didn't do it. They're not saying she didn't do it. What they are saying is that she wasn't in her right mind. Something didn't, something basically, for a better lack of words, something made her feel that way. And the only thing that you could probably look at would be the medications, in my opinion. So that's where that's at. Bruce, Gene, you're awesome. Gene, you're same age as Nancy. Bruce, thanks. Gas, I'm not a troll. Gene, Bruce, thank you for your kind words. Bruce, you're welcome, Gene. Fin Fan, laughing out 1985. Gene, Lacey and her husband are divorced. She divorced her. April, right? No one is denying she did it. Yeah, and no one's denying that she did it. They're just saying that this was most likely medication that was contributing to her state of mind. And the state of mind is everything, right? So the state of mind, in her state of mind, she probably literally, it very well could have played a role in what happened. Now, as Doug was saying earlier, some people are saying that they think maybe even the husband has a role here, and it'll be interesting to see how they go ahead and proceed with the court hearings with that husband. You know what I mean? Because that's very important as well. Barney said, was it ever discussed if the children ever showed signs of abuse? I don't think they were showing signs of abuse. Dev, do you know that answer by any chance?
No.
Okay. No, it wasn't. Or no, you don't know the answer, or no, it wasn't.
No, there was no signs.
Okay,
From
thank you.
that was testimony from the husband, the parents, even the doctors afterwards said that there was no signs of any kind of abuse. No one ever seen Lindsay be anything other than a loving mother.
Okay. Thank you, buddy. Appreciate that.
Yes, sir.
April, Barney, I never heard that in court yet. Interesting. So now let's look at. So the defense has described her as being placed on a complicated combination of medications, eventually 13 psychiatric medications, according to its presentation. The defense argues that Lindsay was improperly treated. Her underlying illness wasn't properly recognized. Medications produced or worsened side effects. She became increasingly dependent on medication to sleep, and the combination contributed to a severe psychiatric deterioration. A defense expert also said that psychiatrist Donald Condy testified that Lindsay's medical records were usually sparse and that that important testing included thyroid hormonal testing relevant to postpartum symptoms wasn't performed. He criticized the treatment she received. So now you have a psychiatrist by the name of Donald Condy who is also coming out saying he did not agree with some of these therapy methods, if you will, for a better lack of words. April, Barney, I never heard that in court. L, she snapped, in my opinion. So sad. We investigating, dropping by to show some love real quick. You got it, my friend. Thank you. We investigate. Appreciate you. Melly, hi, we. Carol, hello, Wayne. L, hello, Wayne. April, and the husband divorcing her, in my opinion, says something to me. Says something too, in my opinion, right? Do you know, Doug, when exactly did he get a divorce with her?
I'm not exactly sure when the divorce happened, but it was only 4 months later that he actually moved to New York and got remarried. So
Oh, wow.
it was pretty quick.
Interesting. So now you have a psychiatrist who, by the name of Donald Conde, who's basically not agreeing with what was done. Now, the prosecution disputes the defense characterization of Lindsay's medical care and has presented testimony from doctors who treated and evaluated her. Her family says, well, this is the major part of the defense case. Her family says Lindsay wasn't simply hiding a murderous intention. She was telling people that something was seriously wrong. Her mother, Paula Musgrove, and sister Allison Ozga have testified about her escalating distress, insomnia, suicidal thoughts, and fears. Her former mother-in-law, Susan Clancy, testified today that Lindsay was essentially begging for help before the unaliving, and was worried about her dependence on sleep medication. The defense wants the jury to see the pattern. Lindsay was becoming progressively more mentally ill. She repeatedly sought assistance. The illness wasn't adequately recognized. She eventually became psychotic. Now, the psychiatric diagnosis is disputed. And this is important because there is broad agreement that Lindsay was experiencing serious mental health problems. They both said that, the defense and the prosecution. The dispute is what those problems actually were. Defense diagnosis. The defense says Lindsay was suffering from postpartum, bipolar, severe depression, hallucinations, medication-related problems. Of course, the prosecution says they argue that Lindsay's symptoms don't establish legal insanity. Some medical professionals who treated Lindsay before the unaliving diagnosed depression and anxiety, but did not believe she was psychotic. So the jury has to decide whether the defense experts' retrospective assessment is more convincing than their contemporaneous observations of her treating providers. I mean, it's just, I guess it goes to say that when you go to a doctor or a psychiatrist, I mean, there has to be some accountability. Because everything that I've read and what I'm reading and everything I'm hearing, in my opinion, I mean, there's a lot. I don't know if you can hold her accountable for the actions that she exhibited. I mean, it's one thing to say, she was not in her right mind. I think we could probably agree that that's for sure because they both agree that. But they're just saying she wasn't, the prosecution is saying she wasn't so bad that basically she didn't know what she was doing. That's basically what they're saying, for better lack of words. Oleg, I'm not commenting on this as I have stayed away from it. I have my reasons now that I have heard how quick the husband got married again. That is the biggest red flag in it all. Well said. Well said. Well said. Oleg, good morning. April. He was still with her, I believe, at that point, Barney. The divorce was after the unaliving, but Doug would know for sure. Any Oleg. A to Z, morning, Chad and DD, morning A to Z, Bruce, okay, Barney, sorry, Oleg, hi, Bruce, hi, A to Z, hi, Z, hi, Annie. What else you got, Doug? Anything new? Anything else you want to add in?
I can answer the question there. They were still married at the time. It was 4 months later when he moved to New York and moved in with his now wife. But there's this little thing that happened on their anniversary.
Okay.
And there's photos and stuff of a lady at a spa getting a spa treatment on the day of their anniversary that everyone assumed was Lindsay, but Patrick himself said that they didn't go out that day. And if you look at the two photos of the two women, they're doppelgangers. I mean, they look identical. So they're saying that the new wife was there prior to the incident.
Interesting. So, do you think, from what you know in the case, was he having an affair? Is that a possibility, or what do you know about that?
For sure.
You broke up.
Hasn't been proved yet, but it.
Well, I don't know what Doug said. I know he broke up again, but I think he's saying he thinks there might be an affair. Is that fair to say?
Did you hear?
You're coming broken up, buddy. All garbled.
All right, I'm gonna leave and come back.
Okay, buddy. That doesn't sound right at all. 4 months later, says L. Melly, February 24th, it was reported he was dating his now wife. They got married April 2026. A to Z. DD, okay. Remember I asked if there was anything lurking, linking Bart and Katie? Willie D has a picture that leaked that Bart and Katie together. And remember, Trayson told you're crazy, man, as he walked by Nolan cradling Kay. Was that Trayson, or was that actually that was I don't think that was Trayson that said that. I thought it was oh God, the judge's son, Warren. How do you know someone 4 months to know them enough to marry them? That's the whole point. Maybe he was seeing this woman for longer than that. I don't know. That's just my opinion. I mean, it's possible. Could she have found out? And yeah, I don't know. It's a very good question. And when did the unaliving happen? Well, I think the unaliving happened. I'll tell you. January 24th, 2023. January 24, 2023 is when I believe it happened. Lindsay was at home with the children. According to the prosecutor, she arranged the Patrick to leave the house to pick up food and medication. That detail has become extremely important. Prosecution interpretation, they say, this is the prosecution, Lindsay deliberately got Patrick out of the house so she would have an opportunity to unalive her children. The defense interpretation says the same behavior has to be understood through the lens of a severe psychotic woman who was no longer thinking normally. The fact that someone performed organized actions doesn't necessarily prove they aren't psychotic. The question has become a major issue among psychotic experts. So basically, yeah, I mean the unalivings, Lindsay unalived all three children in the family's home. The children were 5, 3, and 8 months. She used exercise bands to wrap around their heads. The defense doesn't fundamentally dispute that. Lindsay calls the children's unaliving. This is important. This is primarily a she didn't do it defense. It's she did it, but was she legally responsible for doing it because of all the medications that they were on? FinFan, January 2023, asked Bruce he might know. L, so he was dating a little over a year. April, okay. That's for stopping in. Thanks for stopping in. Pam, bye, Kay. Have a great day. Thank you, Kay. Appreciate you as always. Correct. I started dating her. Correct. L started dating her February 2024. Way too fast, in my opinion. 1985. Oh, I see. Thank you. So there's a lot there, guys. I mean, granted, we're just really just scratching the surface, but there's a lot more there. There is literally it is being televised on Crime Stories channel. I believe that's what Doug said. And you can watch the trial to get an idea of, because the defense is doing their thing now. And it is also terrible, without a doubt. Gene, the affair, etc., Terra is a whole separate issue. Yes, it is. It is. Doug, can I join Pano in a couple of minutes? Yes, Barney, you can. Matter of fact, let me go ahead and give you the link. Right, all right. There's the link, Barney. And there's the link, Doug. April, we is covering it. Bruce Davis, there is so much. Melly, watch the trial, says Bruce. Hi, Doug. Good to see you, brother. Gene, Miss Barney. So we is covering the case. You can go ahead and go to his channel and you can watch the case. There you go, Doug.
All right, I'm back. Not sure what I missed, but sorry about that.
No, you're good. You didn't. I don't think you missed anything. I mean, you've been pretty much answering everything that many of us have had questions about. April, what would YouTube.com? We investigate. So We Investigate is covering the case. If you would like to go to We Investigate and watch literally the trial, you can do that. But that's what I'm saying. I'm looking at this and I'm asking myself, just on what we've discussed, just what we've talked about, I'm asking myself, where is my thought going right now? Right now, I'll be honest, in my opinion, and I don't know everything that's out there. I just know what I've read and what I've observed. And I can tell you that just on that thought alone, it is, to me, to my opinion, is that this lady was just on too many medications. The powers to be did not get her help when they should have, and the facilities didn't take her in like they should have. So, or not so much the facilities didn't take her in, but the psychiatrist should have ordered that, that she should have explained to her why she needed to go in, and it should have been supported by her husband and family members, which I think it was, but just in case it wasn't. And yeah, she should have been in a facility that would help her adjust and find her right medicines that would help her. So I'm looking at this more of a, in my honest opinion, more of as of a negligence on the side of the psychiatrists and the doctors. But that's I'm just saying that without reading everything else, and there's so much more to look at. But just based on this a little bit, that's where I'm leaning. Just saying. If you want to support Wayne, you can watch it there. That would be a very good way to support Wayne, is watch the live from We Investigates. Her husband was already been understand quite a few days ago. Fin Bruce, maybe you need to watch Trial, in my opinion. Gene, husband has already. Barney's in the house, everybody. There you go, Barney.
Hello, everyone.
Hello.
Hey, Miss Bernie.
Hello. I hope everyone's doing well today.
Absolutely. What's on your mind?
I have not followed the Clancy case very well. I think I saw one day of it, and there was just a lot of back and forth between counsels and the judge, and she was speaking to somebody saying, I understand you don't want to have anything to do with me, blah, blah, blah. So I'm not real familiar with this, but I do have some questions. Sometimes I need to go in chronological order.
Right.
So, Lindsay...
Ask Doug. I'm sorry, Barney. Ask Doug, because he's the one that's following this a lot closer than I am. So make sure you direct it at Doug.
Okay. Thank you. So Lindsay and her husband get married and then have children, correct?
Yes.
Okay. And do we know when Lindsay started seeking help?
It was shortly after the latest child was born. So he was only 8 months old, and I think it took 3 months, and it happened in January. So I'm thinking it was like August.
Okay.
August, so September is when everything started.
Okay. And they already had an 8-year-old and a 5-year-old.
That's correct.
Okay. So I'm assuming they were married at least 8-9 years.
Yeah, I think it was marriage 2018.
Okay. So they go on to have children. She seeks help. Wow. Mind-boggling that in this day and age, people can't get the help they need, but it happens all the time. What bothers me, okay, so did the husband leave her before she passed away?
Before the kids, you mean?
Yeah, before the kids passed away.
No, it was after.
It was after, okay.
All
right.
But there's speculation that the affair was happening prior, but he didn't actually leave until afterwards.
Okay. Wow. Because I was thinking, what kind of father would not still be interacting with his children, but that's not the case.
No, he was there. They lived together. He actually even worked from home. His office was the basement where the kids were found.
Oh no.
And Lindsay was, at the time, she was still on maternity leave. So she was home taking care of the kids, making him dinner, and doing all the things that good moms would be doing.
So strange. The lack of fingerprints just, it leaves a huge question mark, because as Dog said, if you're going to do something like that, you're not going to bother to put on gloves or anything like that. You're just going to do what you have to do.
Very
Yeah, and
true. Very
there was
true.
no gloves found either. So
No, they're in Arizona.
yeah, probably in Arizona. You're right.
It just sounds very questionable to me.
Right.
Now, if he may have been having an affair with someone, might that factor in somehow that somebody else may have done something?
It is very possible. Yeah, and I think that's why a lot of people feel the way that they feel about the husband. But feelings don't matter. It's proof. You got to have proof and evidence.
Exactly. But sometimes, once in a while, there's proof in somebody's feelings. They're just. I know it's not part of the law, but wow. So then, and where did this incident happen? What state?
Massachusetts.
And then he moved to New York and remarried.
Yep.
Wow, that is fast. And what quicker way to get a divorce?
I mean, I don't really blame the fast divorce. I mean, after what happened, it doesn't even matter who did it, but the fact that it happened, I could see that there was a quick divorce. It was how fast he moved on and was in another relationship. That's questionable to me.
Correct, especially after losing your children.
Yeah. But we all grieve differently. I can't really hold that against him. There's no proof.
No,
of the
exactly.
affair.
Exactly. But wow.
But it's definitely a red flag in my eyes.
Absolutely.
But she doesn't deny that she did it, but she doesn't admit that she did it either, correct?
That is correct.
That is correct. She doesn't remember, so she's pretty much going by what was told to her, what she did.
If she was heavily medicated or even going through withdrawals, she very well may not remember. Wow.
Yeah, just from the drugs alone could cause you to leave the memory, let alone the trauma. I mean, she was in a coma for quite some time after she went out the window.
Does she remember that happening, that she went out the window?
She doesn't remember none of it.
Wow.
Nope.
And I can't imagine saying to any of my friends or family, I'm having thoughts of hurting the children, and somebody not going, oh no, let's get those kids out of there.
It's very well said. Absolutely.
Call Children's Protective, or just say, hey, let the kids come spend, the weekend or week with us. And meanwhile, you're in touch with people to raise the alarm for the children's safety. Things don't fit together.
No, they don't.
Nope. And I think that's where her sister actually comes in and played a big part during her testimony because of her job. Lindsay's sister is a social worker, and she is legally obligated to report any findings that she may see during any case, not even just family. Like if you see something, say something, she legally has to report it.
It's
And
20.
she
That's a
claimed
24/7 thing.
she didn't see anything. There was nothing that rose to the level of concern of intervention.
Now, if there was an 8-year-old, an 8-year-old would be kindergarten, first grade age. Did anybody ask any teachers what they may or may not have picked up on?
We have not heard from any of the teachers yet, so I don't know. I think that the school, by Lindsay's own words, knew that something was going on later on because she had stopped driving due to the symptoms. So towards the end, she stopped driving.
Oh, I did not know that.
Mm-hmm.
Because schools are mandatory reporters as well.
Yeah, I don't think there was ever any signs of abuse, bruising or cuts or missing school or bad behaviors or anything along them lines. None of that was present.
So she really must have been doing a good job with the kids.
I would go a step further and say that was probably her saving grace was the kids.
Oh, absolutely.
You know, that could have been the saving grace. I know that, you know, she unalived them, but then you go back to the main thing. Was it really that, or was it, you know, she just, you know, was overwhelmed and made this situation happen? But it's not necessarily attributed to her because there was a lot of these serious medications that could have played a big role, you know?
Yep.
A very big role.
Wow.
And also the nuance behind the postpartum psychosis itself. There's a misconception that you would have seen it long before, like even days, weeks leading up to this, but the psychosis can happen almost instantaneously. Like you can be fine 1 hour, you can enter a psychosis for a period of time, and then an hour later be fine again.
That's correct.
I never experienced that, so I'm not really familiar with it.
Neither are the doctors, and they're really not trained to even deal or recognize with the postpartum psychosis, and that is another part of the defense.
And bipolar itself can be difficult to diagnose.
It definitely can. The only thing that disqualified her was the non-existence of the mania. She experienced all of the down parts of it, but not the hypervigilant part of it. So the doctors say.
For bipolar?
For the bipolar diagnosis, yeah.
Okay.
So she
now
had the depressed part of it, but not the manic part of it.
Okay, now that I do have very limited personal experience with. My son-in-law was bipolar. Wow. You didn't know what to expect from one moment. And when he started saying, I hear voices, a huge red flag went up. I'm like, it doesn't matter what the diagnosis is at that point. It's just something happening that, you know, got to remove the kids.
Yeah.
Or at least some type of test, thyroid test, blood test, saliva test, like something. There was nothing.
Well, it's another case of, I think there were probably 3 or 4 doctors involved, and sad to say, I also don't think the pharmacist was checking interactions, because I know my pharmacy will red flag something and call me aside and say, if you take this and this together, this could cause a very bad reaction. And these are all prescriptions from my one doctor. And I was like, oh wow, okay, at least the pharmacist caught it. So there is a huge lack of communication. Most constantly. And I know this may sound silly, but one of my thoughts is, hey, you know what? We can go to the mall and get anything we want. Why can't we have a mall of doctors, psychologists, psychiatrists, pharmacies, one stop, one stop,
Yep.
instead of, oh, well, hey, um, you, you know, you have to go see somebody, another 30 miles away in 6 months. Well, hey, no. It's not a perfect thought, but I think that somehow it could still be done, in my opinion.
That's definitely a good opinion to have, because right now what we're seeing is a lot of, for better lack of words, negligence was done. We're not seeing anything as far as like you would justify that he has literally, for the most part, the husband has went ahead and literally may have had a role to play in this whole thing. We don't know. We don't know.
Well, yeah, that's another concern, like, was her husband helping her with her medication or hindering her?
Yes, yeah, and that's a good question. I don't know. I mean, because when Doug gives all these information about the role of what the husband was doing, why he didn't, maybe, I don't know if he did or not, but why he didn't like insert himself more into getting her, to go into a psychiatric hospital or something to that effect. And then you look at all the other things, about how there was no fingerprints and all that kind of stuff. Just makes you wonder. It would make anybody with common sense beg that question. Did he have anything to do with it? And I don't know if he does. I don't know if he doesn't. What I do know is it doesn't make sense.
Yes, and at a minimum, his disinterest and just disconnect from her and her healthcare being her proxy was definitely there. Like he just didn't seem to really care.
And then what? How long was he with this girl before they got married?
It was within 4 months of the incident.
4 months of the incident. Wow. That's like a fast turnover.
Yeah, that's what I'm saying. Like, I have never walked those shoes. I don't know, but I really don't think I would just hop into another relationship unless it had been a long-term relationship.
Right.
Mm-hmm.
And I'm talking a very long time relationship.
And I believe that's where a lot of people's minds go. That one fact plays a huge role in people's opinions of Patrick.
Now, has any of the family spoken court?
I think the mother-in-law and the mother. Yeah, I was going to say. I think the mother and the mother-in-law and the husband
and the father-in-law, Patrick's parents and her parents, and Patrick and her sister, co-workers. They've all spoken, and they've all pretty much said the same thing. Even Patrick agrees with the defense that she suffered from something, probably most likely postpartum psychosis. Yeah. He agrees that that's what happened that day.
And maybe that was the reason for an affair.
Yep. Very possible.
And then another nuance is there is actual civil suit coming from both parents. Patrick and Lindsay have civil suits against doctors, hospitals, facilities, moving forward.
In this day and age, with all the electronics, there isn't any reason why all of these doctors can't be connected. There's no excuse.
I agree with
especially
that.
with the portals. Like I don't even know if they weren't connected. I think all the information was actually in the portal, but none of the doctors took the time to even look.
Yeah, all they had to
That's the
do was a
problem.
couple of clicks. Yeah, a couple
Pick
of
up a
clicks.
phone call, make a phone call, click on your button, and look at what was happening when she went and seen the other doctors at any given time, and they all did the same thing, which was pretty much nothing.
Mm.
Yeah, because most of those portals are all connected in some way, shape, or form.
Exactly.
I mean, or most of them are. Now, I'm not going to say all, but most of them are connected where you can go and look at, all like the updates on what they found, if they were doing some test or whatever. You can
Oh,
read all that. That's all there.
but wait. Oh, here may be the factor. The patient has to sign documents that it's okay for one doctor or hospital or whatever. You have to sign paper giving permission to have that information sent to anyone.
Well, and that may be so, but I'm think that there were to me there would have been no indication that they didn't do that a long time ago. They had three kids, you know what I mean? So they would want to have. I would think they would have wanted doctors to be able to see if there was anything wrong. You know what I mean? In the wider spectrum to see if there's anything that kids get sick, this, that, and the other.
Right, but I'm not talking about the kids. I'm talking about her.
I get it. But what I'm saying is they could have signed something ahead of time, a while back, not thinking that this was going to be the outcome at the end of the day. You know what I mean?
Right.
They could have. Go ahead.
Because even if she did sign those papers, it doesn't mean that anybody's paying attention.
Well, that's the key. And
it was never explored. That option was never even explored or talked about between any of the doctors.
So that's a thing in itself. I mean, I don't know. I think I look at this, and like I said, I am so new to this case. Obviously, this is like very, very new to me. But just on what I've read, everything that I read, and what I have been able to understand from others, it just sounds to me like I mean, just in my opinion, there was a dropping a ball by the doctors, psychiatrists, the psychiatrists who prescribe these very strong medications, psychotic medications, and also the fact that the husband could have done more to get his wife admitted, especially into a mental hospital, especially when she had told him apparently that she was having suicidal thoughts and possibly even hurting the kids. At that point, you would think he could have done more. Now, I don't know what I would have done if I was in that situation, but once again, you can't turn back the clock. So when everything goes fine, it's okay. But when something doesn't go right, well,
it's already too late.
It's already too late. It was right in front of you.
Hindsight is 2020.
Yeah, absolutely, without a doubt. So I'm looking at it from a perspective of that I think the psychiatrists, there was a dropping of the ball for them, and that's probably why they're being this class action lawsuit. And I think also you could contribute some fault to the husband, because who knew her best and what she was dealing with on a daily basis.
Well, that was a problem in my case. My husband, now my ex-husband, went off the rails.
Mm-hmm.
And so he went to the doctor. I don't know how truthful he was with the doctor, but they did put him on something like Wellbutrin at first.
Mm-hmm.
Something like that. They played with his medication a couple of times, but then he would only have to go back like once or twice a year, and he did do 6 counseling sessions, which isn't much for somebody that's that far off the rails. And every time he'd go in to the doctor or counseling, he'd say, hey, I'm fine, I'm doing great. Well, nobody ever talked to me or any of the rest of the family to be like, how is he doing? What are you seeing on your end? Because he wouldn't sign the piece of paper,
Right.
but I'm completely serious when I say this situation was going to go horribly wrong. Horribly wrong. And it just got to the point where I'm like, nope, it's done. It's over. Before before it is too late. If you can at least let your doctors and healthcare providers talk to me, it shows that there's a problem. And it wasn't that I wasn't paying attention, because I was. I was paying very close attention, but the communication wasn't allowed.
Right.
But in her case, he was her proxy. So that's yeah, un, you know, so sad. Everyone in that case is suffering. Everyone in one
Yep.
way or another.
Well, especially, even the people that, I mean, everybody who knew this family has been altered in some way, shape, or form, you know, and everybody that this family knew in one way, shape, or form has also been affected in one way, shape, or form. So I don't, there's never a good thing that's going to come out of this, obviously, other than somebody being held accountable. And I'm sure that's what's going to happen. I got a feeling that once again, it's not that she didn't do it. It's the fact that it was something that literally could have been prevented, and it was something that she was just not in her right mind because of all the drugs she was taking. I mean, that's just the bottom line for me, anyway.
And somebody mentioned something about the Women, Infant, and Children program.
Yeah, I don't
Yep.
know nothing.
Um, I know where I'm from, it's called WIC, Women,
Yep.
Infant, and Children. And you can go there if um, you're at a certain poverty level.
Right.
They take your children's blood tests, and if you are a nursing mom, I think they give you a blood test as well. So I if she wasn't living in poverty, I don't know why WIC would have been in on it.
True.
Yeah, I don't think it was WIC, the program. I think it was Women and Infants. It's an inpatient facility,
Okay.
which was recommended by her psychiatrist to go and visit them and see if they could help because it was an inpatient care instead of an outpatient.
Okay, so
But
it
she
just
was denied based upon her being over medicated.
that doesn't make a whole lot of sense, does it?
Again, it points to the lack of communication and follow up on the part of the professionals. Yeah, Lindsay's responsible for her own advocacy, but the professionals should be responsible for follow up also.
But if you aren't of the proper mental capacity, you can't advocate for yourself.
And that's the problem.
Yep.
There needs to be some kind of adjustment in the way that the system works. Because at the end of the day, if all we can take away from this is that we can make changes to the system so that it doesn't happen again, then that could
Absolutely.
be a silver lining.
So this is where we, the people, need to bring things to light, even by discussing these cases, because we are also finding fault with our own systems.
Yep.
I know I have advocates, and I don't have to, but I can sign papers for all of them to be able to talk to each other and to also communicate with my doctor. But if I don't sign that, then A can't talk to B, and C to D, and all this other stuff. which I think is a good thing. But yeah, we still have a long way to go. So we need more advocates out there to stand up for mental health, drug abuse, things like that. It, and these cases only bring that to light.
Yep, and that goes to, I mean, we have the closest case that I can think of that would set precedence to this would be Andrea Yates. And that happened back in 2006 in Houston. If you remember, she drowned her 5 kids and she was convicted, and then it was
Oh yeah, I
overturned.
remember that.
And then she was put into a hospital for, but in 20 years, not one thing has changed in the system. It's just more taboo than ever. It just made it harder for the women experiencing these things to come forward and tell the whole truth without fear of repercussion, either being committed to a mental facility or having their kids taken away. And I think that is probably the biggest underlying issue to the whole thing.
Yeah,
Is
because
the taboo behind the condition itself.
Right, and that's also in part society's issue that we don't understand.
Exactly.
You know, it's education, but who gives the right education?
Well,
But-
in this case, not not the wife, not Lindsay.
I think she tried to send a message, but just it didn't. It
don't
was on
think-
deaf
Yeah.
ears.
Yep, absolutely. I agree. Totally
Oh.
agree.
What are you looking at, pup? Oh,
And
you
yeah, and from the prosecution side now, they're actually pushing for premeditated first degree.
What?
That's the charge that they brought against Lindsay.
Wow.
So that's really, and the defense is no postpartum psychosis is a defense, and she wasn't criminally liable because she was suffering from this condition at the time.
So, since she has been arrested, has any proper diagnosis been given?
Not officially, no. Just outside independent people that look at it that are contradicting what the healthcare providers had said at the time.
So that's a problem too, because she still may not be getting necessary care.
Absolutely.
So we may never know the truth of what happened.
Yeah, I don't know.
Right. And if everyone just keeps turning a blind eye to it, nothing's going to change, and it most likely will happen again.
Exactly. So, in a sense, not only are we doing our own little investigations on these cases, but we're kind of stepping up for, hey, why did this happen? How did this happen? How do we try to prevent this? We have these discussions. So it's more than just a case.
Yep.
It is more than just a case. Lindsay is advocating for all women across the nation and in the entire world, really. This is an
Right.
issue that needs addressing by the system.
And even Nancy Guthrie, wait a minute, how does someone just disappear? That's a whole nother ball of yarn, It just every case that isn't solved, it needs to be revisited. Not that any one specific group can, dive into every one of them, but just by the 3 that three main cases that we kind of hash out, even though we are only speculating, grasping at straws. It's still bringing other questions to light.
Right.
So, come on, people, let's stand up and advocate a little.
I agree.
So true.
Gene
And-
says doctors are just too darn busy right now. This infuriates me. In half an hour, visits don't help either. That's so true. That's so true. Hurt him in and hurt him out.
Yeah, and I already have to travel an hour each way to see my doctor. So that's a big chunk of everybody's day doing this. Number one, normally we dread doing it at all, but doctors need to realize this takes our time too. If you walk into a doctor's appointment late, they can go, "We're still charging you, but now we can't see you." Well, if you walk into the doctor's office and the doctor's running late, too bad. Sit there and wait. So, yeah, we do need more doctors, but I don't blame anybody for not wanting the job.
Yeah. Yeah, right.
No, thank you. I'd rather manage the classroom.
Right.
Bruce isn't with us anymore? Okay.
I think he was just saying he was in the back, just listening.
I can't see the chat right now. Let's see if I can change that. Yeah, that's a question I have. Why can't I watch YouTube and see chats?
Can you see it now?
Yep, I can see it now.
Okay.
But if I watch YouTube on my TV, I can't see the chat.
Got you.
I don't understand that. Some mental health workers will not take insurance at all. Oh, that's a good point. Who does and doesn't take someone's insurance? And I know even with some doctors, they have to refer you to somebody else.
That's correct.
Yeah, that is correct. You always got to get seen by a specialist. You got to go through your doctor to get that order. That order prescribed, as far as the order for to see a specialist per se. At least the insurance that we carry out here, that's how it works.
In New Haven, Connecticut, where I live, we have a shortage of mental health workers. I think that's everywhere.
Yeah. I think that's another unaliving breed that's going down. I don't know if it's just too much money is invested trying to get your degree. Too much money is invested, and it's just. I mean, I hate to say that, but I'm sure that has some play in it.
Oh yes, and to maintain your insurance.
Yeah. Then the amount of money you spend trying to get your career started, only to be in the hole, 80 to 100,000 plus, not more. Yeah.
Yep.
I hope you can continue to stay on this case, please.
Oh, I'm going to. I think we're gonna talk about this some more on the 5 o'clock hour. I know it's not. I know it's not Nancy, and it's not it doesn't seem to be like a very popular case as far as watching it, maybe, but not necessarily covering it. But then again, we'll definitely cover it because it's something new, and we can you can only regurgitate so much other stuff from everywhere else.
Oh, absolutely, and I think if you take on too much, you don't get as much out of it.
Yep, I agree.
Pam says, that is why I'm glad I have a home nurse, because she advocates for me if the doctors don't want to help me or listen to me. I know everyone doesn't have that, but I wish they did.
Yep. Oh, I agree. I agree.
It's, and then there's another program we have in my area. I don't know how widespread it is. Um, it's a program for drug addiction and alcohol addiction. And I hate to say it, but most of the people that go through that program, um, they know how to say, yes, ma'am, no, sir, I agree, you're right, I shouldn't do this, I shouldn't do that, just to get out the door again.
Yep. And that's what I said earlier. I mean, that's what a lot of people do. They know what to say. They know how to play the game to get out of there. But I don't know. I think in this case, if they would have put her in, see if they would have put her in there, them being like her husband, there would probably be a certain amount of time that she would have stayed in there. But if she volunteers to go in there, then she can probably volunteer to leave. I mean, I would think.
Yes.
Exactly.
So it's better to have the husband, in this case the husband, have her admitted, so that way she's going to get out when she gets better, not whenever she wants to just say, I'm done, I'm leaving.
You would think he would have wanted to do that for his children's sake.
Absolutely. Absolutely. It was just a very sad situation. I'm glad I started covering it, because I understand what a lot of these medications do to people. I do understand how that works, and I don't know nothing about the case per se, other than what we've been covering. But I do know how that medication works, and I'm telling you, those side effects they are some serious with them. Some of them medications, from Seroquel to Trazodone to even Zopidem to you name it, buspirone to fluoxetine to Prozac, which is the same as fluoxetine. All those things, there is side effects to it, and it's only when when it affects you, with those side effects, then you'll know what you know. You can pull the nano effect. I don't
Mhm.
know what I know until you tell me what you know, and I mean you can put any interjection in there, but yeah, I mean that's the whole thing. There's a
Well,
lot there.
recently where I live, my pup actually busted a porch pirate.
Oh,
Yeah, like just where I'm positioned, I can't see the front of the house, but he was out and he started barking, the
uh-huh.
alert bark. You know, there's that I want to play bark, and then there's that bark of, hey, somebody doesn't belong here. So I took the time to look out front, and there was a lady wandering around, and I saw her trying to take the packages. So I let it go because I couldn't tell if she was on something or needed to be on something.
Right.
But you could just look at her and see she was not of sound mind. So I'm like, I'm not going to approach her, you know. Uh, Thank you, pup, for letting me know. And when I did call for assistance, I started with the police because I didn't know which way to take. And
Mm-hmm.
all I could say was, I don't know if she's on something or needs to be on something. Did she manage to take anything? No, because the dog alerted me. But we need to be alert that this person is out here wandering by themselves and obviously is not in the right mind. Let's take a step to prevent this if we can. And I don't know whatever happened. I don't have a clue. It's not really my business. But, see something, say something. So, hopefully Pup managed to alert me to alert somebody else. And I don't know. Um, I haven't seen her around since. I hope she's getting whatever help she needs, but just no, there was no approaching at all. So it's cases like that where somebody just turns their head the other way, and that's when things happen. I didn't tell the police, oh my God, she's whacked out of her skull and she did this or that. No, I just stated, I don't know if she's on something or needs to be on something, but here's her description. And the only reply I got was, we are aware of her. Okay. Okay. But, I don't know. So sad for those children, the grandparents, all the family. Our hearts go out to all of them. But yes, by covering these cases, we also bring other things to light, and that's a fantastic thing.
Absolutely. Absolutely. I agree with you 100%.
And if people haven't hit the like, share, or join button, please do so. All the support is very welcome.
Absolutely. I mean, like I said before, the only way we're going to go ahead and learn more things is having more people and hearing their opinions and their thoughts, and then trying to process all that. So it's always a benefit. It's always a benefit.
Yeah,
And,
sometimes I just like to know, how did this something whatever get to that point?
Yeah. I totally agree. Totally agree 100%. All right, everybody, let's go ahead and call this. Been on 2.5 hours and 40 minutes. We'll be back at 5 o'clock, probably following up with the same thing, see what's new thing comes out of the defense hearing here in the defense side of the trial, and see what else we can throw in there and figure out. And we'll go from there.
Yes, thank you so much for everything everybody does. So class dismissed till 5 p.m. Eastern time.
You got it. You got it, Barney.
Stay safe, everybody.
Thanks,
too.
Barney.
Take care.
Bye-bye.
Bye-bye.
Bye, Barney. And thanks, Double Pups, and all the chatters, and Dog for having me on again.
You got it, my friend.
We'll see you at 5 o'clock, Dog.
Sounds good, my brother. Appreciate you.
All right.
Semper Fi, buddy.
Thank you. Semper Fi.
All right. All right, everybody. Thank you so much, chat. Appreciate you all. Thank you for being here. Thank you for all the kind words and everything you guys bring to the table. Just trying to cover something different. I know things have been stagnant, but you can only go with what you got, right? So here we'll continue this conversation at 5, and let's see if you get a chance, watch the trial, so you can bring some knowledge back to everybody and kind of share it with us. Everybody's always welcome to come online. All you got to do is just say, if you want to come on the panel, just let me know. Let anybody know, and we'll send you a link, and you guys can come on. All right? With that, peace. Appreciate you all. Thank you all. And remember, it's all common sense. It's all common sense. God bless everybody. Semper Fi.